Thank you, Dr. Bell. Great job in bringing clarity to what can be difficult concepts for people to grasp. We did receive a couple of other questions. One that was very, very common related to DNA testing laboratories. How do we know which ones can be counted on and are reliable?
Okay, so first thing that I would say is that currently a laboratory that identified the mutation is doing a genetic test, that is going to be a reliable testing laboratory because they're the ones that worked all the bugs out. They're the ones that did the identification. They're the ones that are a research laboratory, and they're going to be continually analyzing the results and seeing that they make sense and understanding about that disease. And so they are already integrally related to that test. And so that's going to be a good way to go. But unfortunately, we don't know which genetic testing laboratories, and they are popping up by the handful to the left and the right, and we don't know which ones are actually reliable or verifiable because there is no industry standard for dog DNA testing. And so one thing that has been done, there's an organization called the International Partnership for Dogs. It's an international organization of kennel clubs, of different scientific organizations. The OFA is a member, the AKC is a member, dedicated to the improvement of the health of dogs. And one of their recent initiatives is called the Harmonization of Genetic Testing for Dogs initiative. And actually the OFA was a major sponsor of this initiative. And so what this initiative is, it's to catalog the commercial test providers that are doing genetic testing in dogs. And the work of Dr. Giger and Hereditary Disease Committee of the WSAVA has laid the groundwork for a lot of that, describe the expertise, quality assurance, activities, resources, and host expert panels on genetic tests in order to evaluate these labs and their testing abilities, coordinate a program for standardized proficiency testing of potentially peer review and auditing of genetic testing laboratories. So really give us some ability to evaluate and recognize which are laboratories that are doing good genetic testing and which that are just looking to make a profit, not caring about the results that much. Because unfortunately, many of the researchers in the OFA as well, we find that, that we get some results that, you get carrier test results from two normal parents, and it's a direct DNA test, and you shouldn't have those results. And what we find is that we're coming from laboratories that are not doing proper testing. When they're retested, we find that the test results come up the right way. So this is an initiative of the IPFD. They're working on it. It should be rolled out to be available to the public sometime next year, based on what they're telling us. And then also in working on this, they're going to assemble new resources for genetic counseling and education and the foundations for further developments. And there's a lot of other things that IPFD does. So if you want to follow their work, dogwellnut.com is their website and should provide more information.
Dr. Bell, thank you. One other question, we've had a few of these come in tonight related to mixed breed dogs. I'm assuming they get genetic diseases too. Do they, and should they be tested?
Okay, well, we know, as I said before, that the genetic diseases, the most common genetic diseases we see occur in mixed breed dogs as well as purebred dogs, often with the same frequencies. There was a couple of articles that have been published out of UC Davis, and Bellamore, and Oberbauer that have shown that the frequency of the most common diseases are the same across mixed breed and purebreds, and it's only the breed-specific diseases where we have differences that occur between them. And so with the multiplex testing that are coming out, because mixed breed dogs, many of them come from purebreds originally, they're going to carry those mutations. And so when we have multiplex testing that tests for all mutations, we can have a DNA screen at birth or at a young age of puppies, and just like in people, genomic medicine, you'll know what the susceptibility for the different diseases are going to be in those, and if we can mitigate and mask those genetic diseases through diet, through drugs, through other environmental measures, then that will be possible. But mixed breeds carry genetic disease just as much as purebreds. I see mixed breed genetic disease every day in my practice, as does every veterinarian. It's just whether they recognize it or not.
Great. Thank you, Doctor. At this juncture, I want to thank you for some great information tonight on this topic. Did a great job, sir.
Okay. Well, thank you, and thank you all for listening.
Thanks, Dr. Bell.